A1C levels show the average blood sugar levels within the past 3 months. And for people with diabetes, getting A1C down target levels is a big part of diabetes management. So, how much can A1C drop in 3 months? Well, it depends on a few different factors, but first, let's explain the basics. Hemoglobin A1C is a molecule in red blood cells that glucose attach to. It's measured by a blood test that shows average blood glucose for the past 90 to 120 days, which is the lifespan of red blood cells. So what are normal A1C levels? Based on the ADA standards of care, the normal A1C range is 5.7% or lower. An A1C between 5.7% and 6.4% is in the prediabetes range. And 6.5% and up is in the diabetes range. Lowering high A1C can help avoid diabetes-related complications. Over time, high blood glucose can restrict blood flow and damage blood vessels, and can lead to nerve damage, coronary artery disease, and stroke. How quickly you can lower A1C depends on factors like lifestyle, medication, or if you have other serious health conditions. Some people may be able to drop A1C by 2 to 3 points within a 6-month period through strict dieting and exercise. But others may need a few years, especially if they have little time or are dealing with other diseases. You can lower A1C levels through lifestyle changes and medication. With diet, try to limit the carbs you eat as they raise blood glucose and can make it harder to control A1C. If you choose to eat carbs, avoid simple carbs like breads, added sugars, and processed foods, which can spike blood sugar. Instead, pick complex carbs like beans and starchy vegetables because they break down slower and don't tend to spike blood sugar. Exercise and staying active also lowers A1C. Regular walking is easy on the body and convenient. And if you're able to, strength training or other anaerobic exercises use a lot of blood glucose. Whether you pick between walking or more intense exercises, what's important is to start exercising and do it regularly. Another way to lower A1C is by lowering stress. When the body is stressed, it releases a hormone called cortisol, which raises blood sugar levels. So try to deal with chronic stressors like unhealthy relationships or work so blood glucose doesn't stay high for a long period of time. And continue taking any medications prescribed for blood sugar. You may be tempted to stop medications when blood sugar starts to lower. But talk with your doctor first about your blood glucose trends, whether you're meeting glucose goals, and any needed changes to medication doses. To recap, the A1C blood test shows average blood glucose for the past 2 to 3 months. An A1C under 5.6% is in the normal range, between 5.7 and 6.4 is prediabetes, and 6.5% and up is considered diabetes. You can lower A1C by planning your diet and regular exercise. And talk to your doctor first if you're thinking of changes to medications you're on. Thanks for watching this video. Find more useful tips and info on type 2 diabetes here at diabetter.com.